Hi, I'm Dr. Siegmund with Chiropractic. I'm here today to talk to you about the correlation between lower back and mid-back pain and golf. So far too often we have a lot of people that come into our office and they have issues into their lower back or their mid-backs because of terrible posture that they exhibit every day, 8, 9, 10 hours a day, maybe even whenever they're sleeping. Maybe they sleep on their stomachs or they sleep on their sides poorly, and this can affect everything into their spine. The muscles will compensate over time, and then that'll give them problems when they head out to the golf course. So the first thing that we always want to make sure that we look at is posture. So posture for the normal spine is having everything into the back line up properly. And then we see it from the side, you'll see that you do have a 40-degree curve into your neck. You have a curve going the other way into your mid-back, and then one going the other way into your lower back here as well. So for people that come into our offices, usually they do have tight lower backs. They mainly have tight lower backs because of two things. They sit at their desk for long periods of time, which leads to tight hip flexors, which is the muscles that you have here right into the front of your pelvis. And then you have tight lower back extensors, or also called erector spinae. So when that happens, you lead to what's called an S posture in the golf swing. You might see it when people, they address the ball, they get down to swing, and you kind of see, and their bottoms kind of stick out. And then they try to keep their chest up, they can't, and then they try to force it, and then this leads to this kind of big S-type shape going on through the lower backs. So when I demonstrate that with the spine, what you'll see is this position here. That's from the side. Now, if you look at it from the back side, you'll see it doesn't look quite as normal here as it does here. Now when that happens, all the joints into that lower back get jammed, they get fixated, and they get what's called stuck. Now when they get stuck, that irritates these joints inside the lower back, and then when somebody tries to go to something as vicious as a golf swing, it leads to a lot of shearing stresses on these joints into the lower back. People such as Jason Day, Ricky Fowler, people have had to withdraw from tournaments because they have back spasms. A lot of it is due to these abnormal stresses that they're putting onto those lower back joints because they have too much tightness in their lower back. Also, the other posture that we see in a lot of people in our offices is what's called C posture. Maybe whenever they address the ball, you see it, they take a pretty decent proper stance, but they can't force themselves to get over the ball. So then they exaggerate, and then they kind of round their shoulders, and then they kind of get this kind of hunchback looking posture. It gets very, very difficult to have a golf swing when you do that because there's no rotation of the upper back. They're not able to take that full range of motion. So when that happens, they try to swing with nothing but their shoulders. It might look like something, I'll put this spine down, look like something kind of like this. They address the ball, hunch back, and then they got nothing. It's all shoulders. So those people don't have issues typically with their lower backs. The biggest problem is either with the upper back and in the neck, or in the shoulders themselves. They're the ones that lead to not only having issues with upper back pain, but shoulder pain as well. Rotator cuff injuries typically happen, and then next thing you know, they can't play the game of golf. So we want to make sure that we're doing is we're correcting that posture. So the biggest thing that you should do is find what's called neutral posture in your golf swing, or what's also called a pelvic tilt. So what you want to do is when you address the ball, you want your feet about shoulder width apart, address the ball like you would normally, and then you want to do a thing called, it's almost called a cat camel. So what you want to do is you want to round the back, and then you want to arch it. You want to round, you want the back sticks out, arch, and then kind of find that comfortable in between, where you have a very, very neutral spine, where it's very in a normal position where you're not shearing the joints or compressing them, and then you address the ball from there. That is the most overlooked part of somebody's game, is when they're addressing the ball, if their lower back's in a good position. Chiropractic can help out these patients that have these problems with their postures into their lower back to help not only take the pressure off these joints, but that'll also help loosen up the muscles. So that way when they go do something like the golf swing, which can reach speeds of up to 150 to 160 miles per hour, even in some of these tour pros, that's not causing pain into the lower backs, not only into the joints, but into these disc spaces as well. This is kind of that caused the demise of Tiger Woods, because he had so much lower back issues already. He tried to compensate for that by having, lifting weights, trying to become stronger into his upper body, but he didn't commonly affect the issue into his lower back. So what that caused was some disc bulging. That's something that can become exaggerated into the game of golf if you don't get that lower back looked at properly by a chiropractor. Make sure you come and check us out. make sure we do a thorough examination, check everything into your lower back, make sure all those joints are all firing properly, so that way you can enjoy the game.